So for all women having prenatal care, it's important to get early prenatal care because a lot of the lab work will determine if there's any problems early on that need to be addressed. Not only will twins have normal lab work done that all women have, including looking for signs of anemia, infection, STD screens, checking to see if you're immune to rubella, checking for things like hepatitis and HIV and things like that. Also looking for signs of protein or abnormalities in your urine. That's standard for any pregnancy, but with twins and triplets, you are increased risk for gestational diabetes, number one. That means there'll be 2 tests. Usually we do a traditional test for gestational diabetes between 24 and 28 weeks, but with triplets, you'll be screened in the first trimester as well again between 24 and 28 weeks. If any one of those tests is positive, then you'll have a 3-hour test which will determine if you actually have gestational diabetes. Other testing will be done as you get farther along, testing not necessarily lab work, but what we call antepartum testing in the form of non-stress tests known as NSTs and BPPs known as biophysical profiles. These are tests that start at approximately 28 to 30 weeks with twins and triplets. They basically monitor the progress of the babies as far as their health. And what we mean by that is we're looking for signs of fetal well-being. Every time the baby moves, you should see an acceleration in the heartbeat. So, for instance, with NSTs, when a patient comes in, the baby basically is put on the monitor and we make sure that there is an acceleration in the heartbeat every time it's moving. With triplets, it's hard because you have to have 3 monitors going at the same time. Sometimes, because triplets can be tricky, that those tests can be done over labor and delivery. Those are more difficult to do in the office. The biophysical profile is specifically looking for signs of fetal well-being. That will be done at least once a week, starting around 28 to 30 weeks. That's a test done with an ultrasound that looks at the amount of fluid around the babies. It also looks to see if the babies are moving. It looks at the tone of the babies, and it also looks at to see if the babies are practicing breathing. Even though there's no fluid in there, the babies do move the fluid in and out of their lungs, and it's known as breathing, and only the healthiest babies do that. So those are some of the things that we look for on the biophysical profile. And again, with triplets, it is an increased risk not only for preterm labor, but for cord accidents. Now, for you, Amy, you're lucky because your babies are all in different sacs, but that's not always the way. For some triplets, you'll have 2 in one sac and 1 by itself. Whenever you have 2 fetuses growing in one sac, there's an increased risk for a cord accident. Up to 50% of those babies can potentially not make it to term because of a cord accident, or also known as a cord around the neck. So that's why we do try to look for any signs of fetal distress starting around 28 to 30 weeks, which again is just more common with multiple gestations.